America under national emergency. If you haven't already heard, you probably already have. I don't know what's going to happen, all right, but I have some ideas. So I'm going to talk about a few things. I'm going to go over the numbers again. I'm going to go over some numbers around where I live, which is Fort Bend County or Texas in general. The case numbers have gone up, and these are case numbers that are being tested. Okay, and most likely they're severe enough to be tested right now. Uh, testing, full scale testing, has not occurred yet until Monday. So, what is today? Today is March 16th. So it's March 16th, but I'm recording this at 12:13 a.m. March 16th, 2020, Monday, but it's 12. All right, 12:13 a.m. So I just barely passed Sunday. Yeah, I barely passed Sunday. Now I'm into Monday, but I've been waiting for this website here. This website COVID.bio to reload, and I kind of like it. I have to wait for it. I like it mainly because of the map here. I like looking at this map, and yeah, 72 cases in Texas. As you see here, we reached 3,499 cases total to date, 772 new cases today. Now, I think these are just recorded numbers from Johns Hopkins. The data comes from Johns Hopkins. Some of the other aggregate websites are delayed, and some of them are actually showing more, so, but about the same. 63 deaths, and the number 9 deaths today. So, what I said March 16th we would reach 2,000. Well, that was reached Saturday, and from Saturday, Sunday to it's still Saturday, it's still Sunday. I mean, I barely pass into Monday, but technically I said Monday, so I guess technically it is Monday. But we're at 34 or almost 3,500. So at this point, I could just assume we're at 4,000. I'm just going to round up. I remember when when China had their 4,000th case. I remember that day. A week later, literally a week, not even a week later, 5 days, not even 5 days. It was 4,000 confirmed cases reported on Monday, I think I remember. And then 1, 2, 3, 4, 5 days later, but literally 4 days after, on a Friday, so Monday to Friday, it was up to 10,000. And I think we're going to be looking at that situation. And at the time, I believe the report coming out of China was everyone was on lockdown, or the lockdown was starting. And so I don't know if the situation in China may be different or similar, but I'm hearing different reports that the numbers from China at the time that when the Wuhan, the epicenter, the coronavirus broke out at the epicenter of Wuhan, the numbers seem to be lining up. The trajectory seems to line up with what happened in China is happening in Italy, happening in Spain, whatever country you're in. It's the numbers are lining up, the projections are lining up, and in America, it's lining up. And so it looks like most likely by Friday we're going to be up to 10,000 total cases coming up here. So one of the things I'm going to talk about is I'm going to talk about a lot of things. First, I'm going to talk about some things that surprised me. There was a report in the Houston Chronicle about a man who tested negative for the coronavirus, had the symptoms, and then tested positive. So this kind of this may give you a clue of maybe some of the missed opportunities that both the health system in general, maybe the government, and maybe in general the general public may have not really, you know, considered how serious the situation is or was going to be. All right. And so I'm going to talk about that a little bit. I'll leave links in the notes section. If you're coming back, thanks for coming back. Please subscribe, like, and share this video. If you're new to the channel, please subscribe, like, share this video. Share, subscribe to the channel. This will be premiered. Again, I told you it's 12:18 a.m. right now, March 16th, 2020. I will premiere this 9 a.m. Monday morning. That's just my schedule right now. That's just how I'm doing it. And then, of course, I'll have my daily videos. I guess we'll just go through the numbers, right? Then another thing I'm going to talk about is I'm going to talk about a man who, unfortunately, he's smart, but at the same time very stupid. Hoarding. Please do not hoard. There's a lot of panic buying going on, but this story is about a man with a whole bunch of sanitizer that he can't sell because Amazon, eBay, and probably all these other platforms have basically stopped the sale of like toilet paper, hand sanitizer. They're just shutting that down. A lot of businesses are getting fined for quote unquote price gouging if they're raising the price up 10% before the declaration of emergency, and a lot of people are declaring emergencies. Okay, matter of fact, Friday, Trump declares national emergency. All right, and you don't do that just anytime you want to, um, and so did many states and many counties. They've all declared an emergency. All right, so uh, it's very serious. This should tell you this is very serious indeed. Okay. And then last, I'm going to talk a little bit about panic buying and what the stores are doing. And not only that, but also, um, you know, some of the stores are limiting their hours. And what may happen is you may end up being in a long line. And I'm going to talk about how you can mitigate some of that and how you can disinfect your groceries or whatever you bring home. I mean, we're at, let me see, I'm going to go scroll down here real quick. Houston is literally at 72. So times that by 5, there's like over 100 people. Anyways, um, so I'm going to talk about that a little bit later. All right, let's just go into the stats here. Let's just go to the stats. My goodness. Um, yeah, if you look at this graph, it is going crazy. It is going crazy. It is going crazy. I am in the state of Texas here. It's at 72. Other website have it at 51 or 60 something. I don't know what happened, but all of a sudden it's gone from 50 something to 70. There's 20 more new cases out there. I haven't read anything yet, so this is all new to me. So there's a lot going on. Although what's funny is West Virginia, for some reason, does not have any cases. I don't know what they're doing. It's hard for me to believe that West Virginia has 0 cases. I really doubt it. I don't think they're testing, or they're not trying to test, or they don't have any test. Or maybe the lawmakers like banned the coronavirus, and that's why West Virginia does not have any cases. But I think that's going to change very soon. Let's see. Look at New York, 732. Yeah, it's just a lot. Florida's really getting up there. Florida has over 100. Um, it's not looking good. Here's the regional. New York has taken the top spot. I don't know what it is about New York, but they want to be number one. All right, you're number one. I wouldn't want to be number one in this in this case. But 207 cases today, new cases today. They just blew up. I don't know if this is New York City, but either case, New York is not looking good. This is not very good for New York. This is bad. And it was only like a week and a half ago they had very little cases. They've jumped from nothing to almost 1,000 cases here. In another 2 weeks, we're going to probably see their death toll most likely rise. They had three, one today. So, that's the unfortunate side effects. The death will lag the confirmed cases. So let's see, Texas. Texas right now, 72, 72. Okay. Numbers are creeping up. My gosh, if you just look at the new cases and the new numbers, it's going to happen. It's going to increase. I want to talk a little bit about herd immunity. I don't know if I have time for that, but I'll try to squeeze that in. Um, but if you look at the numbers, 772 cases. I think that eventually you're going to start seeing 1,000 and over from this point on. It's going to be 1,000, and they're going to start testing. The test kits will start rolling out by Monday, which is technically today. You're going to see these numbers start to exponentially increase. It's That's what's going to happen. I've been watching this thing since China and Italy and Spain, and now it's just here in America, and it's going to be a very rough time for a lot of people. So let's talk about herd immunity. Now, the British UK is totally taking a totally different approach to how they're going to manage this. Uh, it's interesting. It's different. I don't know if it will work, but they're taking a huge gamble. I think either way, it doesn't matter. Um, so herd immunity is basically that if everybody gets infected and now they have some kind of immunity because now the new virus has been detected by your immune system and it knows what to look for next time. When it gets infected again, it can just attack the virus right away before you even get sick. So if there's enough people who got infected and have this herd immunity, the people who never got sick, who never got infected, well, you're going to be protected. All right, the herd will protect the uninfected. So the herd immunity will protect the uninfected. And so that's the concept behind this herd immunity. And then the most vulnerable people will be sheltered from that, and then by then they should be insulated through the herd that has the immunity. I don't know. That's kind of risky. That's kind of risky. Anyways, let me go back up to here. Let's go back up to numbers. Let me just go back up to the news here. So it looks like we got these are the case numbers. Let me see what the other ones say. This one has more in 69 versus 63. Um, slight difference, but essentially the same. The curve's going up. 737. That's how many new cases are there reported through this website. Let me see. I think they have a death right here, which is 11 deaths. So they have an extra 2 deaths here. So different number on different aggregate website. This is Fort Bend County here. This is the DSHS, Department of Social and Health Services, maybe Texas.gov update just for the coronavirus here, and then right here is the county, and so Bell County has 1, Bexar County has 3, Brazoria, which is a little bit south of where I am, has 2, Collins County, which is 6, Dallas County 8, El Paso has 1. I think they may even have more by this time. Fort Bend County has 9. That's a lot. Harris County is these 2 counties in general. Even Brazoria is very close. Brazoria, Fort Bend, and Harris County are very close to where I am. I'm in the middle, which is Fort Bend, Harris County, which is north, Brazoria, which is south. So you got 19, 20, 21 confirmed cases. I'm surrounded. Galveston Island, that makes 21, 22. I mean, there's a lot. Gregg County 1, Harris County 10, Hayes County 1, Lavaca County 1, Matagorda 1, Montgomery County 3, Smith County 4, Tarrant County 3, Travis County 1, total of 56, but now I know there's more because obviously this website says there's 72, so obviously there's more. I think they update 12 in the afternoon, so this was updated 12 in the afternoon, and this will be updated 12 Monday p.m. p.m. So, all right. Here's another article here. Houston Chronicle: Fort Bend County man tests positive for coronavirus after testing negative for days. Interesting story. Man comes back from a travel, 70-year-old man, I believe, has symptoms of the coronavirus. And this is like late February, early March is when this happened. And what's funny is uh, this man went to Sugarland Methodist Hospital. I was actually across the street from Sugarland Methodist Hospital. This person could have been just walking around shedding viruses. Who knows? It took them until like I think the late February into like early March 8th, I think, to get a confirmed case from the CDC. There was a lot of back and forth, and the family, they weren't wearing any masks, they weren't wearing any gloves, and they were just, thinking he has some kind of flu and maybe the virus. I mean, they're still taking care of him. He was actually in home isolation, and apparently he's still alive. Maybe mild case, but this kind of tells you that this situation has been going on long before, long before everyone is crapping their pants, right? February 20th, I think I read somewhere in there. So, and then getting the test, they tested negative, then tested positive, tested inclusive. So a couple days went by, maybe a week went by before, something was done about this whole thing. And all right, next story. Next story. Oh gosh, this man was getting death threats. He basically, Hixson man hoards massive inventory of hand sanitizer during COVID-19 outbreak, but now faces death threats. I think he had a New York Times article where he was basically complaining how Amazon wouldn't let him sell, the hand sanitizer and wipes, and he's got like thousands, $15,000, $20,000 worth of sanitizing hand sanitizers and wipes he can't sell. And once the story broke out, he was getting death threats. Um, yeah, sign of the times. So I think he donated those products, but we'll see. We'll see. This is sign of the times, people. Sign of the times. All right, last thing here. Last thing. All right, H-E-B stores closes early, 8 p.m. till further notice. So I think they're open 8 a.m. and closes 8 p.m. I think Walmart, Kroger, Target, I mean, you name it, the stores, grocery stores probably have limited hours now. I think mainly because people are just going crazy. It's not everywhere. It's not everywhere, but the major places that people just off the top of their head think of about going, yeah, they're getting panic buying is setting in. People are trying to buy like months of supplies and food. Everybody's trying to buy months of supply and food, and of course, you're going to get a run at the grocery store. The irony is there is no shortage. There's no food chain supply disruption. There's no food shortage. There's just panic buying. So, at some point, I guess if this continues, going to the grocery store will now be hazardous. There's a high probability you might get infected just by going to the grocery store. And so I'm going to talk about how you can disinfect your grocery supplies or whatever you get in the door or even your house. And like I said, I was using the steamer with water, and I think 16, not very much, 16, 18 ounces, no, 16, 15 ounces, maybe even 12 ounces of water, and then just 1 ounce of bleach. And I'm able to steam my whole house. I can steam the doorknobs, I can steam the floor, And the nice thing is it doesn't get wet. It does, I believe, sanitize. I do believe it also, the heat does help in killing the virus, as well as the disinfective agent, which is bleach. So that's my easy tip. That's my tip of the day is, bleach and water and a steamer. That's going to help you disinfect a lot of your groceries and a lot of stuff you get outside the house, and so you can bring it in. You don't have to wait 15, 20, 40 days. I mean, this is, come on, let's not go too far. But most importantly, wash your hands, wear gloves, wear a face mask. All right, and if you have a mask or N95 mask or whatever mask, and just be careful out there. And so I'm going to show you how you can disinfect like your groceries. What I've been doing, I'll share what I've been doing, and I think this is very economical and very effective and very practical. Um, you got to be very dangerous, or you got to be very careful, because it could be very dangerous, first of all, to go to the grocery stores at this point in time, because there's a good chance that there's a whole bunch of people out there, and there's a good chance that they're infected and they don't know it. Um, there's also a good chance that some of the employees who are stocking the shelves are sick, infected with the virus, the coronavirus, the Chinese coronavirus, the Wuhan virus, the nCoV coronavirus, the novel coronavirus, COVID-19. This thing has so many names, I can't keep up. Anyways, I've read some reports that some employees of grocery stores have been confirmed with the coronavirus, and they're stocking the shelves. And you're going out there and you're buying, the groceries. You're touching it. Now, ideally, you want to wash your hands, right? So ideally, you do want to wash your hands. Another option, and at this point in time, this is what I am doing, all right? And I'm also recommending everybody to do it. I'm telling my wife, she's going to go out, she should wear gloves, all right? She's the one that's going to be going out. She's the one working, so she's going to work. Her work is not that bad. She just drives to work, goes in the office, gets the mail, whatever. She can wash her hands. There's not many contact in what she does. The issue is when she goes to the store, and I'm gonna have her basically go to the store until like it becomes unsafe to go to the store, or I feel it's unsafe. If it's too crowded, if there's too much standing in line, or just not enough food, which is recent, it's been that way. I think Friday, when the national emergency was declared, uh, I had her go to the store. Just told her, just get whatever you can. I mean, something's better than nothing. And she told me all the meat was gone, the ground meat was gone. A lady had a cart full of just meat. She must have had a freezer. People are really panicking, and there is no food shortage. All right, there is no food shortage. There is no food chain supply shortage or disruption whatsoever. People are just buying more off the shelves than the grocery chains and stores can restock the shelves. That's it. That's it. There is no food chain supply disruption. All right. There's plenty of food. They're getting delivered. The problem is people only have like a day and a half worth of food at home, and everybody is now crapping their pants and trying to buy at least a week's worth, maybe a month's worth of food, like everybody. I understand the panic, because if you're a parent, you got a call saying the school is suspended for 2 weeks if you're here in Fort Bend County, just like I did. Um, I did see this coming a mile away, thank goodness. I just want to be just a little, over precautious, and I'm just trying to top off my food supply. But at some point, it's going to be too dangerous to go get food. I do believe that. And so the more time that goes on, the more infected people that are out there. Please subscribe, like, Share this video. If you're new to the channel, please subscribe, like, share this video, share, subscribe to the channel.